I can tell from the look on your face, Melissa Meisty from Nephew Physical Therapy, that I have stumped you. You don't know what this is. It's strange, because you're a baseball fan. My absolute favorite movie would be something called The Field of Dreams.
Oh, I'm like, what are you talking about?
We are building a field today as we talk about baseball players and we talk about wings. How do wings relate to somebody who plays baseball?
And you're not talking about hot wings, about the ones you eat. You're talking about your physical body.
Yes.
Yes.
Okay, so I came in this morning and I said, let's talk about scapular winging.
Scapular?
Scapular.
Define scapular.
So scapular shoulder blade. Everybody know what shoulder blade is?
Yeah. Yep.
Shoulder blades, right? They ride along the back of your rib cage, okay? The clinical or the anatomical word for that is scapula, and that then connects to your shoulder. So scapular winging is, I will call it gross. Sometimes it looks really gross. When you look at somebody from their backside, when their arms, their wings, or comes off of their rib cage. Can you see that on somebody? Right? Like you're at the beach, somebody goes to raise their arm or their head, or they throw a ball or something. The shoulder blade will actually come off, okay? Because as you raise your arm, your shoulder blade has to rotate around the rib cage. Okay.
Is that only if you have well-defined muscles?
Well, that does make a difference.
Or
Absolutely.
you're
Well,
I wondered that.
when you are thinner, you see everything,
That's
right?
right,
That makes me
true.
think of my kiddos who, yes, right? I can see every rib, every bone, everything, for sure. No, it does not necessarily decide or is determined by your body type. What it is there's actually, so we talk about the rotator cuff, or my favorite, it's called the rotor cup. Have you heard that? Rotor cup? It's kind of like, I feel like it's the piston cup in the Cars movies, right? The rotor cup. It's actually the rotator cuff, which is responsible for rotation, okay? So tennis, right? We always talk about tennis because Jean plays tennis. My husband plays softball. I play softball. Volleyball season will be starting. And so when we do rotation, we're kind of taking our arm and we're throwing. So we need motion that rotates backwards and forwards. And the rotator cuff is made up of 4 muscles, 3 of them that come around the top, around kind of the outside margin. But one of those muscles actually is between your rib cage and your shoulder blade. So it's kind of tucked in between the bones, okay? And so if those muscles are not strong, it doesn't hold it against your rib cage as you go to move.
Okay.
So, in other words, you could possibly get injured if you throw a ball or go to serve a tennis ball or something like that.
Does this muscle become detached? What happens to this that doesn't allow it to function properly?
So it's usually weakness and an imbalance, okay? So we often see a weakness or imbalance between the chest muscles and the shoulder blade muscles, all right? We're traditionally stronger in the chest, and certainly posture doesn't help at all either, right? We're rounded, we get forward, that pulls us forward, which will also then make that shoulder blade wing or stick out, okay?
You say posture and you're taping us on a Facebook Live thing, it instantly makes me want to pull back the shoulders and stand up
Back,
straight.
head up.
It's so true. Every time we say posture, everybody thinks we just need to sit up. Posture is more than sitting up straight. It requires strength and flexibility. So wherever we want to be strong, we have to be flexible in the opposite muscle group, okay? So if we want to be strong in our shoulder blades, we have to be flexible in our chest.
Suddenly I feel more deficient.
So are we going to do like chest push-ups here?
Well, it's ironic that Cynthia kind of mentions that here, because chest push-ups or countertop push-ups is actually one of the things that we do regularly with patients to improve flexibility and shoulder blade strength. When we were talking before about how this gets people in trouble, what happens is if you're doing a lot of throwing motion and that shoulder blade does not adhere or kind of ride along the rib cage, you are at risk of injuring your rotator cuff, which is impingement, rotator cuff surgery, those kind of things. And what we see happen, especially we're getting a lot of young kids that are playing tons of throwing sports, right? Baseball season, softball season, and they're throwing and their shoulder hurts and they don't know why. And we literally just simply ask them to remove their shirt, to look at what's going on the backside, and we can see, sometimes you can just feel it through the shirt, right? That shoulder blade just pops right off, and we're like, oh, there's weakness here, right? That shoulder, we don't need, it's not the shoulder per se that's specifically the problem. It's the weakness surrounding it, and it's really our job to dig into that. And it's funny how sometimes it really is that simple to identify it.
Okay, so how do you fix that?
You strengthen and you stretch. It's actually fairly simple, the approach, but it's not quick. That is always the challenge, right? Is everybody wants a quick fix, except for this has probably been around for a while, and it's going to take some time for us to do that.
So if you were a ball player, if you were a Little League ball player, if you were a Major League ball player, and you had this develop, would that mean taking time away from the sport that you love so much?
The sooner we address it, the less likely we are to miss time from that, okay? And so, yes, it's normal to have shoulder pain or soreness for a day or two after activity, or if you did a lot. But that lingering, long-lasting pain should go away. And so our goal is to not make anybody stop having to do their activity. But like we talked about a couple weeks ago, sometimes we have to focus on fixing you so that you can get back to what you love.
So typically one of the remedies that people like you, physical therapists, would offer would be to ice it down. Is that part of the solution too?
Absolutely. It's so funny. At my team's softball game last week, excuse me, one of our players had played in a volley grass tournament. So they play volleyball all weekend on grass, and her shoulder was sore. That had been the weekend. It was Thursday, and she's like, Melissa, what do I do for my shoulder? I said, did you ice it? Right? I was like, you need to be icing that shoulder because it's 5-6 days later and it still hurts. You need to ice it down right away. And simple icing is 10 to 15 minutes every 2 to 3 hours. You should start doing that right away to get any acute inflammation down.
So how do you know when to ice and when to use heat?
We get asked that a lot, okay? So I have a tendency to use ice a lot more these days than I ever used to, just because it actually really feels good. We always think, oh, it's cold, but when I have an elbow flare up or my neck gets sore, those kind of things, it's amazing how wonderful ice is to cool it down. What we do want to be careful with, though, is we don't want to ice it down and then go do activity or do your therapy exercises or anything like that, because you've iced it down, you've numbed it up, so your body won't be able to tell you that hurts, don't do it. So traditionally, we do a lot of icing in the beginning. The challenge becomes, is if it's a long-term on and off problem, you're recreating a new injury almost every time that it happens, okay? So my elbow starts to feel better, I go out and play a long day of tennis. Is that chronic in the fact that it's the same thing I've had for a long time, or is it actually flared back up again and we need to ice? So I usually lean towards the side of icing, but we also like to, if we're going to do some stretching and stuff like that, like to warm up a muscle so that,
So the heat will warm it up. Okay.
Or riding the bike or, doing some type of walking, those kind of things. That kind of warm up is good.
Yeah, I like the phrase, the heat is on. Melissa, Mike T from Nephew Physical Therapy. Don't go anywhere. We'll be right back. More of our discussion coming up on The Pledge.